Our next, our next guest is Dr. Victoria Awugboro Adeleye. Adeleye Awugboro. Dr. Victoria is a doctoral-trained psychiatric nurse practitioner with a particular interest and training in trauma and addiction medicine. She has over 10 years of experience as a mental health professional. She obtained her MSN in psychiatry from Northeastern University in Boston and a Doctor of Nursing Practice degree from UMass Amherst, and is board certified by ANCC to assess, diagnose, and treat various mental health conditions, including anxiety, mood disorders, depression, bipolar disorders, PTSD, OCD, amongst others. She is a compassionate, thoughtful, and empathetic provider. Welcome, Dr. Victoria.
Thank you, Ade. Thank you. Hi, everyone. I'm happy to be here. I'm excited. Thank you for this opportunity. Like Dr. Nikki said, it's much needed in our community, and it's not something we get to do often. So I'm glad you guys are having this, and honored to be one of your panelists. Thank you.
Okay, so let's get started. Our first question will go to you, Dr. Nikki. What are some unique challenges that African immigrants and Black Americans face when it comes to seeking help for mental health issues?
Thank you, Adesua. So before I go into those challenges, I should say fortunately, most of us here came from different African countries, and we're here because of the American dream. We're looking for good education, wealth, good health, and stable income. And with that comes some challenges that people face, like culture shock, loneliness, new identities, language also. Even sometimes coming from an English-speaking country, you have to then learn the American English, the American accent, so that can be very tough to deal with. A lot of people have some traumas that were never treated before they migrated to the United States. And now being faced with also a new trauma, those things can lead to a lot of anxiety, depression, low self-esteem that unfortunately sometimes can go without being treated. Also, we have to discuss the racism in this country, discrimination, microaggression, bigotry. So because of that, most of us, some of us do have mental health issues that comes maybe in the form of anxiety, depression, trauma, PTSD, sometimes even psychosis because of the pressure that people face in this country. And because of so many challenges, all of these things can go without treatment, and that can affect people's livelihood, success, and to be able to move forward in life. So to answer your question, Adesuwa, some of those challenges, one of those that I'll be discussing today is stigma that's associated with mental illness. Coming from Nigeria, before I moved to the United States, I didn't even know anything about psychiatric. I didn't even know psychiatrists and medical doctors. I always thought maybe they just went to a 4-year college because it was never diagnosed. It was never discussed. It's not something that we talk about. People think because if you're depressed, it means you're weak, you're lazy, or if you're anxious, you're a coward. So it was never discussed. And even if you discuss it, people look down on you. So because of that, a lot of people avoid getting diagnosed. I have a lot of patients that they would rather go to their primary care doctor because they think by seeing the primary care doctor for depression, then it means they're not technically depressed.
I think your mute button just came on.
Can you hear me now?
Yes, I can.
Okay. So because of that, a lot of people avoid getting treatment or seeking treatment, whether in the form of therapy or medications. I know people that even if you talk to them about getting therapy or couples therapy, the idea is, why do I need to talk to a stranger to address my issue? I'm man enough to do that myself. I'm strong enough to do that myself. I don't need an outside influence to tell me what to do, how to manage my life, which unfortunately, it's not like that. Also, there is distrust of healthcare system in this country. Not in this country, in general. People think Americans love to diagnose. Like, yeah, if I go to talk to my doctor that I'm not sleeping or I'm having anxiety, then they will start diagnosing me and then telling me that I'm crazy, and then I might end up on the psychiatric hospital and people would term me crazy. So they don't want to do that. And also because of history of healthcare system in the Black community in this country, we cannot ignore that Black people were kind of mistreated in a way in the years past. We all know about the Tuskegee syphilis studies, where Black men were not treated for syphilis for years just because they were being experimented on. So because of that historical, because of that history, a lot of people do have mistrust in healthcare system. People worried about being prescribed medication that will affect them. And a lot of us also believe that in spirituality. So I'd rather go talk to my pastor. I'd rather call my family back home to prepare some herbs for me rather than going to see sick Western healthcare. So that also affects it's one of the reasons why people avoid seeking mental health treatment. Also, because of lack of providers from diverse ethnic background. Personally, sometimes I feel more comfortable seeing a Black African American, because I feel maybe they will understand me. And I've seen patients that will come to me and they were like, oh my God, you're Black. Oh, you're African. They feel more comfortable. And when you feel like there's no representation, like you don't see somebody that looks like you, that speaks like you, that understands you, you might be reluctant to seek help. So that's also another reasons why a lot of people do not want to seek medical care or psychiatric care or mental health care. Then lack of culturally competent providers. So what that means is, even though you're from a different culture, you're competent, you're humble enough to want to, or willing to want to treat somebody from a different culture. So what that means is you have to be willing to understand, to be patient, to know where the patient is coming from. An example would be in Africa, or I would say maybe in Nigeria, because I don't want to generalize. In Nigeria, when you're talking to your elder, you don't look them in the eyes, you look down. If you do that in this country, it kind of looks like maybe you're anxious, you're shy, and that can lead to misdiagnosis. So you need to be able to understand the culture of that particular patient, why they do what they do, and why they're acting the way they're acting. And another example would be treating a Muslim woman. Sometimes they will prefer to see a female provider as opposed to see a male provider, or they might want to defer some decisions to their partner, to their spouse, to their parents, to their husband. So you have to understand that. You have to understand where they're coming from. And if you're not culturally competent, you will not be able to treat or provide adequate care to that particular patient. So a lot of people worry that if I go to see my doctor now, they won't understand where I'm coming from. So because of that, they avoid, or they relent, or they don't want to seek psychiatric treatment. And then lastly, lack of insurance. or under insurance or cost of healthcare. So when people first come to the United States, obviously they may not have insurance, or they might be working under the table, or they might have high copay or high deductible. So to them, mental health is kind of the last resort. They might worry about the physical health. Okay, I need to see my doctor because of my blood pressure, my diabetes. But for my anxiety, I can deal with that. I don't have to worry about that. That's not something that I want to deal with right now. So it's kind of at the back burner. The people don't want to deal with that because of that. And also because American healthcare can be complicated sometimes. It may not be easy to navigate. Even as a doctor, sometimes it's very hard for me to navigate some systems. So because of that, the confusion, people don't know where to start, what to do, who to contact, how to go about it. So those kind of things can be, can be challenging to a lot of people and prevent them from seeking necessary care.
Thank you so much. That was so extensive and really wrapped up quite a bit of this. So we'll go to the next question. We'll go to Dr. Victoria. If you can, I know that some of these were addressed already, but if you can tell us a little bit about how we can address the stigma that surrounds mental health in our community.
Thank you. So one of the ways we can address stigma in mental health, it's exactly what we're doing now, community awareness, right? I know Dr. Nikki took us back to roots, Nigeria, Africa, all of that. Personally, I was first exposed to psychiatry, mental health, all of that back home in Nigeria. When I went to school, I schooled at Yaba Tech. I was a science lab tech major. So I was doing my IT at Central Lab Yaba, for some people that know Lagos. And Central Lab Yaba shared a compound with Yaba Left. So that's Nigerian Yaba Psychiatric Hospital. So every lunch break at 2 p.m., they bring all the patients out for a walk. So because of that, we IT students, a very big compound. So we IT students will purposely put our break time for 2 p.m. so we can go and see the crazy people, right? And we'll just laugh. We'll laugh at them. They'll line them up. We'll be like, look at this one. I think this one is a rich man. He's wearing expensive agbada or whatever. And that was my first exposure to that. But outside that, the normal stigma of crazy people was always embedded in my head. So awareness, education, we need to do a lot more of what we're doing now, bring the educational awareness to the people, cultural competence training, like Dr. Nikki mentioned, coming to this country, personal experience, two personal experiences that I'm going to share. First one about cultural competency. I lost my dad a few years ago, 7, almost 8 years now. And I got that news at work, right? I was a nurse already. I was working in a psych hospital. I got the news at work and I lost it. And they were kind of holding me down, tying me down, like, oh my God, our nurse is crazy. Let's get medication. All of that was going on. It was just chaotic. Why? Because they're not aware of how we grieve in Nigeria. Because I was just like all over the place, screaming, oh, I'm gonna kill myself. And that was a big deal for these people to handle. So after the whole event, the hospital came to an agreement to have a cultural competency training for all staff so that if anything like that, they know, okay, culturally, this is appropriate for Victoria to react like this. It's not like she's crazy. It's just cultural for her to be like that. So we need a lot of that, cultural awareness. We need community partnership. We need to get involved with leaders in our community. Once we provide that education, first, that mental health is a serious thing. And mental health is just like any other illness or ailment that you might have. It's just that it affects your brain. You know, when you have diabetes, that affects an organ in your body, that affects your pancreas. When you have high blood pressure, it affects the way your blood is pumped. When you have heart disease, it affects an organ, that's your heart. When you have mental illness, depression, anxiety, OCD, post-traumatic stress disorder, any mood symptoms, they're just normal imbalances that we have in our body. So we need that to provide that education. We need to partner with leaders in our community. We need to partner with our religious leaders because religion is big in our culture. So faith-based organizations, groups like this, we need to bring all of that into our community. Peer support programs, you know, we can address stigma through peer support programs, against through community partnership, right? We need to tailor our intervention culturally. So if we know faith is a big deal for Nigerians, for Africa, then partner with their leaders, with faith-based organizations. Tailor your intervention that way, like, oh yeah, the women group meets on Wednesdays. Let's tailor this intervention for mental health to women's group meeting on Wednesday. When you have someone there speaking to them, then they're like, oh, okay, actually, I'm not crazy. When I'm depressed, it's because there's chemical imbalances in my body, and I can address it the same way I will address when I have a headache, when I have stomach pain. Well, with the same way we will care for someone and support someone that is diagnosed with cancer, we can also support someone that has depression that way. So those are the ways, and also open dialogue with families. That's huge, because the second personal story that I'm going to share, which is actually what led me to want to be, or not just want to be, to be, because now I am, to be a mental health provider. Because while I was in school, I thought I would end up being in the emergency room. I love high energy environment. I'm always that person that is go, 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 go. So I'm like, okay, when I'm done, when I'm going to specialize, I will be in the emergency room, you know, where there'll be calls all the time. Oh, there's a new gunshot wound. Let's go. We're running to save a soul, right? But then like a week after I finished my nursing school, I had my first child, and then I got postpartum depression. So that period, the way it went and the care I got kind of shifted my focus to now want to do mental health. And the first person I reached out to actually was my own mom. She was there with me. I was by myself. And my mom came for my graduation, and I was having a baby, so she stayed. My husband was back home in Nigeria at that point. He wasn't here. So when I started having those symptoms, I noticed I was sad. I wasn't sleeping. I was afraid something bad was going to happen to the baby. I told my mom, like, and she was like, what is wrong with you? You know, you just have a baby. You should be happy. You know, that was the reaction. So this is where I thought I would get support, but it was total like shut down. And then I would go in the corner and be like, I think something is really wrong with me. Like, so I didn't really get that support because why? She wasn't aware, like educationally aware enough to be able to provide that support to me. But then luckily for me, being being in the medical system, I was able to reach out for help. I called the hospital myself, like, hey, something is wrong here. I told them all my symptoms, and the doctor was like, oh my God, are you okay? Should I send an ambulance? I said, listen, I called myself. I'm fine. I can't come to you. And that was how I was able to get help through that process. But imagine if I was like just a commoner in the sense that I'm not of the medical field. If I'm like an accountant, a lawyer, you know, I probably won't be able to get that help because I've turned to my mom and she shut me down. Then I would just sit silently and this will get worse. So, you know, we need to engage the families as well. so they will be able to provide that help and support where needed. Because it's happening a lot in our society. You'll be surprised. Sometimes I do a lot of personal talk in my church community. I recently actually spoke with a lady that she experienced the same exact thing that I did. She was having postpartum depression. She opened up to her husband, and her husband was like, "What's be depression? You say anything like depression in Nigeria?" So when I shared my experience with her, she's like, "Oh my God," because I'm this happy-go-lucky person. I'm like, I had postpartum depression. So that kind of gave her that relief. I said, you didn't kill nobody. It's chemical imbalance. It could happen to anybody. Black, white, rich, poor. It's not something you did. You just need help. Let's help support you. And I spoke with her husband too, so he can be there more for her. So we need community partnership. We need awareness program. We need education. We need cultural care, cultural competence care. I'll pen it here for now. Thank you.
Wow. I could tell, some of the people who were on Zoom that I can see their faces. When you talked about your mom's reaction, people just smiled because they're like, we get it. Like, we know how families do respond, like, what do you mean depression? We don't have that in Nigeria. Yeah, but we do actually have it. We just don't talk about it. So thank you both for really giving us that overview. I'll have a few more questions, but I do want the people on Zoom to know that you would also get a chance to ask questions as well. My next question is for you, Nike. What role do shame and fear play in avoiding treatment? I know you talked about some of these quite a bit. So if you just want to give us like a summary, that would be good.
Yes, like Victoria said, there is a lot of stigma around mental health. People worried about, like I said earlier, being discriminated against, rejections from others. And also, I think one of the issues that we have is some of the words that we use, some of the diagnoses are commonly used words that we throw around every day. People use the word, I feel depressed after having a bad day at work, or I feel anxious. Oh, I have something coming up, so I'm worried, I'm anxious about that. Everybody assumed that, oh, when somebody is clinically depressed or clinically anxious, we're talking about day-to-day sadness or day-to-day anxiety. And another word that I kind of see being thrown around frequently is OCD. I'm OCD. Oh, I like to do my thing. Why this way? But when we're talking about clinical OCD, we're not talking about liking to do things one way, having like routine. That's not what we're talking about. So because of that, people assumed that because if you're struggling with depression and anxiety, then that's what you're talking about. So why do you need to go seek help? So because of that, people stay silent. They're worried about being judged by people around them. Also, they're worried about being misunderstood by the healthcare providers. I see this a lot in my practice, on my years of practicing, where unfortunately, when primary care physician or other specialists, once they see that you have psychiatric history, anything that you complain about is because of the psychiatric history. So now if you're having abdominal pain and they've given you medication, it's not working, go see your psychiatrist. It's somatic, it's psychological. And a lot of people worried about that. Like once I had that on my record, is that going to follow me everywhere I go? And is that going to affect me down the road? So because of that, people shy away. I've seen patients where they were like, can you not put that on my record? Can you, or is my employer going to have access to my record? I don't want them to see that I have depression or anxiety. So they're worried about being judged or being misunderstood or just being termed as crazy. Like anytime you complain about something, oh, you have depression, go see your psychiatrist. And a lot of people have gone undiagnosed or where they miss serious medical issues just because everybody assumed it's all in their head. So go see your psychiatrist. Also, people worried about, like, by seeking help, they're kind of acknowledging past trauma. Unfortunately, in Africa, a lot of us went through a lot of traumatic experience, whether physical abuse, sexual abuse. Thank God for social media now. Everybody is now coming out where you will see young girls that were raped by a family member. People went for years without seeking treatment. So by now, for them, it's like now they're acknowledging that that trauma happened to them. Or by seeking help, it's like they're blaming their parent for being abusive to them. But that's not the reason why. But because they're worried, they're fearful, they're ashamed, they don't want to, sometimes by treating or by seeking help, it's like you're kind of bringing your past into your current life, and they don't want to do that. So because of that, they avoid, they're ashamed and they're afraid of seeking help. Also, the fear of unknown, the fear of if I go on medication, is it going to affect me? Is that going to change my personality? So those are those things that the shame and the fear that plays significant role in why people avoid treatment or care. Patient will come to me like, if I go on antidepressant, is that going to affect me? Am I going to go crazy? Am I going to look like I'm on drugs? Is that going to affect my personality? Is that going to prevent me from having babies down the road, or my kids are going to be affected? So some of those fear prevents them from seeking help. And like Victoria said, one of the ways to avoid that, shame, fear, these are kind of normal emotions. You just have to make sure that it's not affecting your day-to-day activities and it's not preventing you from seeking necessary care. So you have to accept that, okay, I'm ashamed, I'm worried, but it's not going to prevent me from going ahead and seeking necessary help. And also by creating the awareness that Victoria mentioned. I'm not going to go through that again because of our time. And for now, I'm going to stop right here. So
Thanks, Nika. Victoria, what happens when a person goes untreated for a long amount of time or any amount of time? What happens when someone goes untreated?
So untreated mental illness can impact us significantly in a lot of ways. One, I'll start with your work performance. If left untreated over time, you'll find significant decline in your work performance, your day-to-day work performance, and overall functionality. And, this can lead to increased absenteeism from work. Your performance is down. Then you start, say you have depression. Some people, part of their depressive symptoms is they can't even get up in the morning. They drag, they come to work late every day. There are those people that will have excuses, or excuses under the sun. So decreased productivity, decreased work performance, increased absenteeism, relationships, some people's symptoms, if they have like mood disorder, they can get irritable for no reason. People will start avoiding you. So it affects your relationships. It affects you personally. You neglect your responsibility. You can't even function. You don't see anything wrong with, not showing up, not doing what you're supposed to do on time, just because of your mental health symptoms or illness now. So these are the symptoms that start playing out. It also affects your physical health because you're sick mentally, you don't even have time. Even though some people, they will still feel that pain of the physical illness, but they don't have time to seek, or no motivation to seek help for those physical ailments. And it also kind of now makes this worse because if, say, you started with just depression and that is neglected because you didn't seek help or seek care, and it's left untreated, that will now lead to all of this other stuff that I've mentioned. Your work productivity is down, your relationship is affected, productivity is out the window. Now it's affecting your pocket, right? Because work, you've been absent multiple times. Now you're worried about finances, and now your mental health. And say you don't have insurance to even seek the mental health, or because of your symptoms, you're not reaching out to seek help. Now, instead of just depression, you're anxious about, oh my God, I have all this issue. I don't know what am I going to do. now you're anxious, and it's just leading to a whole lot of issues along the way. So, yeah.
Nike, you talked about some of the ways that we can overcome some of these issues. But I'll ask you about how can we as people ensure that mental health resources and services are accessible, and we can always choose who our provider is going to be in some ways. So how do we, make sure that we have resources, services are available, and if we can choose a culturally competent provider, how can we go about doing that?
So by doing our own research, right? So for example, when I'm going to seek care, I do my own research, I go online, I look for the hospital, I look for clinics, and then I will ask for, like, sometimes I will ask for a specific provider that I feel like, you know what, this is someone that I think will be able to work with me. Also, there's nothing wrong when you go in there and ask questions. Ask your providers, like, okay, what's your understanding about African American immigrants? How many immigrants have you treated in the past? And what's your understanding about cultural competency? So those kind of things. Also, maybe sometimes like some community health center, those are places where being African American, you tend to see a lot of Blacks in those places. So you go to those places. So that will be because it's by just looking at somebody, you don't know, are they like culturally competent? Are they going to be able to work with you? Are they going to understand where you're coming from? So we need to do, thank God, most of us are professionals. Some of us are like maybe first generation immigrants, second generation immigrants. So the idea of using social media or going online research, Googling, I'm very sure everybody is very versed with that. So by doing your own research and asking questions, it's encouraged. Even before you see that provider, you can call the hospital and say, okay, these are my needs, and this is what I'm looking for. Is there anybody you would recommend for me? And like I said, go to like places like community health center where you see people that kind of look like you or think like you. I mean, that said, also you have to be able to balance that by making sure you're able to receive the appropriate care. So my best recommendation is to do a lot of research. I hope that answered your question.
Yes, it did.
Okay.
You both have a great way of sort of like feeding into each other's remarks. So sometimes I'm like, okay, she just answered this. I'm gonna ask another question.
Okay.
As we are coming up to time, I would like for folks to please start somebody beat me to this already. I'd like for people to start putting their questions in the chat. And so that way you have your questions queued up to go. My last question for you, Victoria, is talking about the role of racism. I know that, Dr. Nike sort of like mentioned that in the beginning, and I don't want to make light of the fact that that is a big issue. You've talked about, some things that you experience even culturally. But what about the role of racism? We can't dismiss it.
Yeah, so racism plays a huge role, and is still playing a huge role. It didn't just happen years ago, it's still happening. And roles such as healthcare disparity, for example, I work in addiction, right? I have my private practice now. But when I was working in addiction in a big hospital, Boston Medical Center, we had this patient population that they will come in to seek care. And one particular woman, it took her it was a big deal for her to even seek care. She was struggling with alcoholism. So one day we were in a team meeting, and, we were discussing, and somebody said, oh yeah. So I asked about her because I was out for a few. And then I said, oh, what about so-and-so? Has anybody on the team had a chance to meet with her? They're like, oh yeah, since the day we called DCF, she's been gone. And I'm like, wait a minute. For what? Who called DCF? And they were like, yeah, she came in and she disclosed that she was drinking. She went out and she drank. So we had to call DCF because of our little child. Oh, I lost it. I lost it. I was so upset because this is somebody that it took her like a big deal to even seek care. Now she's seeking care for alcoholism. She went out. She wasn't drinking in her house, right? She went out to drink. She disclosed. It's not like we caught her. So I brought up issue of another white patient that we discovered was using substances through their urine screen, right? So we caught the white person. The black person self-disclosed, but we punished the black person. So, and the reaction was, what is wrong with Victoria? And I was like, no, don't look at me that way. You're about to see the African in me right now. Like, who does that? So I had to really spend time to educate them. Some people got it. Some people made face like they got it. Some people were like, so we need to do a lot of this. So there's still that microaggression. It's playing a huge role. There's healthcare disparity. And I reached out to the patient, by the way, and she said she's not going to come back. She said, oh, Victoria, do you know what DCF and Black people, how they heard they're going to be on my case forever now? And I can't get through. I don't even know what I'm going to do. This is why I don't even seek care in the first place. Now your clinic has done this to me. So, so we need to, we'll be talking about cultural competency. When you see something, please say something. I say that to my provider colleagues because it's systemic. Racism is systemic and it's still happening. And we just need to keep saying it. We need to keep voicing it out. Me personally, I'm committed to doing that. I was opportune to serve on the board of nursing 2-3 years ago, right around the pandemic. And the same thing, there's this Kenyan nurse that, they said, well, not they said, she took medication like narcotic substances from our place of work. So she was stealing it and using it, and she was caught. And then they brought the case to the board of nursing. We were discussing, and the vote was, oh, we're going to take her license. Let's suspend her. She can't practice nursing again, blah, blah, blah. And I'm looking at them. And they're like, oh, yeah, Victoria, so what do you... I said, okay, did we know this lady's history? Why is she using substances? Does she have history of trauma? I said, we from Africa. Trauma here is different from Africa. We have the real trauma. Do you know how many people I've seen burnt alive that I witnessed? Do you know how many times? There was a day I was almost lynched because they were burning somebody on my street. I grew up in Ajegunle, for people that know Lagos. They were burning someone on the Thank you for the alien. They were burning somebody on the street. I was coming from church. This is a notorious rapist. Everybody, thank you. Everybody knows him, And I was coming from church, from morning mass. I'm a Catholic. I was coming from morning mass, and people were running. Oh, they've caught Koro. His nickname is Koro. So people were happy. They caught him. They were about to set him ablaze. And I was coming. I just met them right there. Women with stick. They already doused the guy with petrol. They set him on fire. So he was running, and they were sending him back with a stick. So I got there and I was like, oh my God, little Victoria. I was like, oh, and they're like, what did they do this one? You are his girlfriend. Catch that girl. That's his girlfriend. I'm not his girlfriend. I'm not his girlfriend. And I started running. Do you know how traumatic that was for me? It took me days. I would sleep. The scene would just come alive. Like I would see the fire scene. So I was telling this board of nursing folks, I said, do you know what she has gone through? something led her to start stealing narcotics from work. Can we support this nurse and help her to get through this? So at least I was happy that I advocated for her in that sense, and they were able to revert the conviction or whatever they were going to, the judgment, and they supported her through a drug treatment program. The only verdict is she can't work with drugs, but she can keep her nursing license. I said, fine. There's so many nursing roles. So, you know, so stigma, racism, it plays a lot. I'm sorry if I digress a little bit, but I just wanted to have that impact statement that, you know, these things intertwined and they come out in different ways. Thank you.
Absolutely. We have a couple of questions in the chat, so I'll start with the first one. I think it was off the comment that you were making earlier. Nike says, discussing cultural differences. If it's challenging to locate a psychiatrist who understands our culture, background, beliefs, and experiences, would you still advise speaking with an available psychiatrist and therapist?
Yes, I mean that's what the culturally competent provider means. It doesn't mean you have to see somebody who is Black or Nigeria, but you want somebody who understands that your experiences are different, the way that you perceive things are different, and they're willing to learn. And that was why I gave the example of in Africa where our elders are talking, you look down, you don't look up. In America, so if you're seeing somebody, an American, white or Black, you're looking down, they might be thinking maybe something is wrong, maybe you're hiding something, maybe you have anxiety. That would be an example. Or if you defer some informations or some healthcare decisions to your spouse or to your parents, it doesn't mean you're not able to make decisions just the way that you're raised. And it's going to take time for you to adjust to the new culture. So you want somebody that understands, and it doesn't have to be technically Black or white. It could be a white physician that have gone through training in cultural competency, and they understand that people come from different culture. Just like Victoria said, I mean, we like in Africa or even Black America, we express our emotions. We fling our hands around. It doesn't mean that we're crazy. It's just that's how we express our own emotions. Whereas in white culture, white American, they kind of keep everything inward. So you being expressive does not mean you're crazy, but somebody can understand you. So just to summarize, like I said, it doesn't have to be a Black or Nigerian or African provider. You just need somebody that understands your culture and know where you're coming from and know why you're making some decisions and know why you always think about, oh yeah, if something negative happens, it has to be from God, and something bad happens if it's from devil or it's devilish. So you need somebody that understands you. So I hope that answered the questions in terms of seeking care. Like it doesn't have to be a Black or African, but it could be anybody as long as they understand where you're coming from and they're willing to learn from you. Providers, we learn from our patients. In my practice, I will ask patients when I see them, are you religious? How important is your religion to you? So that's me trying to understand them. I don't experience what they're experiencing, but I can hear from them and say, okay, who is important in your life? Who do you like to share your emotions, your feelings with? Do you go to church? How important is church to you? Do you go to mosque, or in terms of spirituality, is that important to you in terms of how you see life? So that's part of me being understanding and try to see where they're coming from and how best I can help them.
Thank you. Someone asked here on a lighter note, who is more prone to mental health disorder? Example, depression between men and women. Is there any research that suggests gender could play a role? So Victoria, do you want to take that?
Sure. So we're all prone, men, women, boy, girl, Black, white. we're all prone to mental illness. Sometimes our genetics, sometimes our environment play a role as to if those mental illness will be activated. You know, some people, like me, growing up where I grew up, all I experienced, I was still my happy-go-lucky person, you know. But does it mean if something happened that can trigger whatever was underlining, then it will come out, it will be triggered, right? So we are prone. It's not gender-based. Mental health is not gender-based. It's not financial-based. It's not your color-based. We are all prone, but sometimes maybe because of more support, maybe because of change of environment, maybe because of your own self-care practices, they may not be activated. Or some people, yes, they may experience it, but they get better support through it and they live their life normally.
Okay, so
And can I just
another-
buttress Victoria's point? So sometimes
can you move closer to the screen?
I don't know why it's so blurry. It's blurry for some reason. I don't know why. Something just, was it blurry like that from the beginning?
No.
No, it's blurry. I don't know why.
It's
Okay,
all right.
so just to buttress Victoria's point, so sometimes, unfortunately, when we're talking about mood disorder, depression, or maybe anxiety, actually women are kind of maybe more prone for different reasons. I mean, hormonal changes is one, and where patient will kind of maybe experience PMDD because of their ovulations. And then if you look at the statistics, actually women are more prone to depression or anxiety compared to male for some odd reasons, like hormonal is another example. Also, when we're talking about mood disorders or any kind of disorders, the first thing is you want to rule out medical conditions. There are some medical conditions that will lead to some mental health issues. An example with abnormal TSH, if you have hypothyroidism, then you're more prone, one of your symptoms will be anxiety and depression. And then if you have hyperthyroidism, that will lead to kind of bipolar or manic symptoms. And we know women are more prone to thyroid issue. So if you look at statistics, I can't talk about thyroid, but it's common in women to have thyroid issues. So that means in that case, they're more prone to depression. And like I said, hormonal changes. And then in general, women, because of their body, I mean, they're more prone to mood disorder, whether depression or anxiety or bipolar. In terms of psychosis, it's the same in both genders, whether male or female, it's the same in both. And the same thing with OCD, it's the same. So it's mostly in the mood disorder that we tend to see more of women, see this more in women than male. And somebody was talking about, was looking at the questions about nutrition, social lifestyles. Yes, there are some, I mean, you don't have to take conventional medications. There are things that you can do right now. It could be, obviously, you want to make sure that you take care of your physical health. You want to make sure that you're sleeping, you have good diets, you exercise. That's also very important. Because when we're talking about mental health, it's not just one part. When something is wrong with one part of your body, it affects other part of your body. So if you're having some medical issues that is not treated, obviously will affect your mental health. I see a lot of patients with pain issues, and because of that, they get depressed. So you want to make sure that you're doing okay. There are nutritions, by changing your diet, you can change a lot of things in your body. Obviously, we always recommend to our patients to, as much as possible, to avoid processed food, avoid a lot of sugar. Those kind of things affect you physically and also affect you mentally. They lead to a lot of inflammation, and we know that inflammation also can cause mental health issues. So anything that will affect that will lead to increase in inflammation in your body needs to be avoided. And like I said, nutrition, obviously, that's also very important. So
thank you. Kenny asked, is cultural competence a mandatory skill for all therapists? So I know that for some therapists, like you can get trained, but is that something like, when you when you're in school, when you're getting your license, is that a requirement that you all have to get? Either one
Yes
can
and
answer that.
no. It's yes and no. So some school have that built in, and most time, even when they have it, it's kind of brushed over. So it's not something that you're like, this is the core of this class. Like you don't pass this, you're not going nowhere. No. So they usually just brushed over. Some professionals are just mindful and they're humble enough that they want to do it. Some places, situationally, like it happened in my place of employment, because they were scared, honestly, because they thought I was going to sue, because it was a big mess. They were going to give me injection. It was just a big mess. So the CEO came to my house. Then they were forced to kind of provide that training. So sometimes situationally, sometimes some provider just want to be aware, or sometimes some people get shamed into doing it. You know, sometimes you just meet this patient that will wash you down, like, who are you? You're not supposed to be looking at my leg that way. And they're like, okay, maybe I better learn this. So yes, in school, they do go over cultural competency, but not as broad as they should. And sometimes I don't really blame them that much, because that's a huge, huge topic, right? Because you have to look at Nigerian culture, Kenyan culture, Muslim culture, what they do in Asia, you know. So it should just be encouraged that we practitioners should embrace that, and we should, you know, broaden our horizon that we were taught from school.
Thank you so much. We're coming towards the end of our conversation. So if you have one or two more questions, please put it in the chat. We're going to be respectful of everyone's time. I know that some people have whispered in my ears prior that, you know, they've got Valentine's Day celebrations they've got to go do. So, excuse me, I don't want you to get late for your dinners and all your niceties. So,
while we're getting ready for questions, though, I just want to point something out that, yes, I'm not disputing, this is not a dispute, but I just want to encourage our men. Yes, women are more prone, but sometimes it's because men are more ashamed. Men tend to shy away from seeking care. So most studies still will point to that have you ever heard a man say, I'm depressed? You know, they will look at you, they will stigmatize you more than they would a woman, because depression is considered weak, right? So men tend to stay away from such studies and stuff like that. So we don't have a lot of data on them. So men, please, you are human too. You got blood and water running in your vein. Let's spread our awareness. Let's educate our men, make them more informed so they can also seek care for depression. Men get depressed, men get anxious as well.
Absolutely. I remember a while back, I was working with a student, and the student disclosed to me that they were depressed. And I was like, okay, let's do something about this. We have the Counseling and Wellness Center. Why don't we go together so they can make an appointment? And the student was like, no, my mom says not to do that. I was like, wow.
You go.
You were suffering. I can see that the student was really suffering. And the student was really scared because their parent was against that. So, and this was a male student. So that's why I just wanted to share that sometimes that, you know, that could be a part of why men sometimes don't seek help. So we have two more questions. I'll save the question from Bowen for the last one because I really like that question. But this question came from Nana. It says, can you say a word about mental health and the workplace for Black people? I know that's deep.
So I can take that. Can you repeat the question again? Sorry.
Yes. Can you say a word about mental health and the workplace for Black people?
If I get this correctly, are you saying like creating awareness?
Is Nana, are you still here? Oh, Nana is still here. Nena, do you want to expand a little bit on your question?
Thank you very much to our panelists. Good evening, everyone. So I think one of the attractions I had for this topic to join the webinar was the record of success, for Black people, and I appreciate all that the panelists have said. But just to know if there's any advice you can give to Black people on how to deal with some of this microaggression in the workplace or in professional settings, how to manage it, because a lot seems to be expected of us, especially immigrants in this society. Thank you.
Okay, so I'm not really, so the best answer that I can give is to make sure that you have enough support around you, and find some level of alliance, I would say. So if you're facing some maybe microaggression or discrimination, find an alliance, find someone that you can maybe an HR person that you can maybe speak to, and then take care of your mental health overall. You need to seek therapy because you need to find a way to process whatever is going on. Sometimes because of our history, because of things that we've seen, that we've heard, we are more prone to pick up some things that maybe other people are not able to see. So people might think, oh, it's not really a big deal, I wasn't being racist. But for me, I think it's racism. I'm being discriminated against. You might just think it's not really a big deal. But for me, because of the history that I have, because of my experiences, because of where I came from or where I am right now, I'm able to pick up those things. So in that situation, I want to take care of my mental health. I want to seek help. I want to find some alliance at work, somebody that I can confide in, somebody that can make possible changes. And then it makes sense. People are doing this now where they're kind of creating more awareness at work. They're doing like trainings and allow people to kind of express themselves. So overall, seek help, speak up, and I guess speak to the HR as well. I hope I answer your questions. So.
Thank you very much. It's not for me specifically, it's just for the general public, because it's
Public.
something I kind of observe. Thank you.
You're welcome.
Victoria, do you want to add to that before I ask the last question?
Just pretty much same. And also to say, I know it's not easy. Take your time to process what is going on. It could be as much, it would take that. And once you are certain that this is what is going on, get support, develop a supportive system, get your point, your facts. When you're seeking HR, they're going to ask you all these questions. And like Dr. Nikki said, sometimes they don't see it the way we see it. And you're the one, they say, we wear the shoes, know where it pinches, right? So you're the one going through it. They may be like, oh, well, maybe she didn't know what she was doing, or he didn't mean it that way. So have your points down, seek those support, seek therapy, because your therapist can help you process some of those things too.
Okay, got one question here that I really like. A lot of times mental health and medical professionals are dealing with so many patients on helping them cope with difficult challenges in their lives. How do the both of you stay grounded in ensuring your own well-being in the process? So who's the doctor's doctor?
All right. So for me, I consider myself a religious person. Sometimes I kind of look at myself like, Victoria, this is 2024. Like, you need to be 2024 compliant. Stop carrying Jesus on your head. But then I kind of do a little self-talk, and I'm like, wait, Jesus has never let me down. That's my happy place, So that's my self-care. I am very self-aware. Sometimes you listen to your patients. Sometimes you can't help but feel that empathy. You're soaking in all this energy. And I just go to my God and, just release. And in his presence, there's fullness of joy. that's where I find my peace. And I know that works for me, and I'm happy I found that, and that has been very, very, very helpful and supportive for me in my personal journey and in my professional journey as well.
Nike.
So for me, I agree with what Victoria said. So I'm a Christian. I'm not gonna say I'm not gonna say I'm religious, but I find safety in that. Also, self-care is very important to me. I'm so big on that. I'm a mom of two. I'm a wife and also a career woman. And sometimes it's very hard to juggle everything together. Sometimes some things have to give. We can't be 100% for everybody all the time. So I have my own personal therapist, someone that I can talk to, that I can share my own personal experience with, my own struggle. So I find that very helpful. I do weekly therapy. I have supportive people around me that I can confide with, that I know they're going to be in my corner at all times. I love vacation time. I go on vacation all the time, even small vacation. I always do that because I know I need myself, my me time. I go on vacation without my kids. Sometimes I go with my sister or my siblings just to kind of ground myself. I need that space. So those are the things that I found helpful in my personal life. I love to exercise, so I do that. So yeah.
Whew. Wow, 1 hour went by so fast. And I am just grateful that the both of you joined us tonight. And I'm more amazed by the folks who not only stayed to the end, but asked questions and just engaged with us. So thank you all. I want to thank the NPG board for putting this together, and hope that you all will join us for more events. Kay, do you want to, before we say goodbye to everyone, do you want to talk about the event that we have coming up in March?
Yeah, absolutely. And thank you for a wonderful session. Thank you for the very insightful and powerful conversations today. A lot of takeaways. We have another event coming up March 2nd. It's tax, and you can see that on the screen right now. More information will be coming. We know it's tax season. For some of you who are yet to file your taxes, I would recommend you probably want to wait a little bit so you can get all that, information that will help you be able to take advantage of new tax laws, and we'll be able to take advantage of new tax benefits for this year. So more information to come, but that's going to be March 2nd, Saturday, March 2nd. I believe it's 12 p.m. Awesome. Thank you. I didn't want to talk, but this year you made me come off minutes, but it's all good.
Listen, well, we're all in this together, aren't we? Thanks. Oh, happy birthday, Victoria. I almost forgot that part. Victoria just
Thank
celebrated
you.
her birthday, and Nike's daughter just celebrated her birthday. I am so pleased because this is sort of like a personal, professional connection for me. Nike is my goddaughter's aunt. Victoria is my godson's mom. So I'm like, hey.
Thank
How
you. Thank you,
wonderful.
Nena.
So thank you, Victoria. Thank you, Nike. And thank you all for joining us. I appreciate you all.
Thank you
Thank
for
you,
having us.
everyone.